It's been a week since the physician assistants embarked on a strike to protest what members deem as a move to subject them to the direction and supervision of medical doctors. Patients seeking services at healthcare centers, including CHIP compounds, are feeling the pinch. At the Kenya's Health Center, nurses say most referred patients are unable to go to bigger facilities.
Once the PAs are on strike, what we do is we refer the patients to the nearby hospitals to seek medical aid. So currently we are not doing anything. We only come to work, sit down, wait for the afternoon staffs to come, then we hand over our important things and then the word to them. It's over 100. It's over 100, yeah.
And where do they go?
To any nearby hospitals. Because all the health centers are facing the same challenges, so they visit the nearby hospitals.
At the Antua Health Center, patients are mostly referred to Menchia Government Hospital. Some patients say they have been left stranded.
Said I left one at 30 and made me dressing and the or my mamma so we better have empty back.
We suffer in our community due to the industrial action. Some patients do get stranded. Government must do something about this as soon as possible.
My Yama woman, Timon Cheyenne. Mesra binds or Mamma Monadi here or mono. One Yama or Mona said the bear so baby she. Now you are in one by hospital and as a doctor so won't show. Any idea about boy sir a hano.
Maybe a man is so more. The
nurses have refused to take care of them, but they still insist on not taking care of me.
Physician assistants are mostly in charge of health centers and CHIP compounds in rural communities. Their absence has created a vacuum in healthcare delivery. A laboratory technician at the Kenya's Health Center, Isaac Owusupoku, pleaded with government to help resolve the situation.
The government is trying to look down on the PAs. Why? Because if you come here and you are being referred to bigger hospitals, I think you can go and receive your treatment. So it's an indirect insult on behalf of the PAs. And I think government must have done something immediately to solve this issue, not even waiting for about 24 hours.
Good morning to you. Thank you so much for staying here on the AM show. I'm Bernice Abubedu-Lansa, and the story you just heard is the basis for our next conversation. As you may be aware, physician assistants are on strike, and they are insisting that amendments be made to the Health Professionals Bodies Act 857. They want freedom to operate independently. We know that there has been in some interventions. The health authorities from the Ghana Health Service has, for example, asked doctors on leave to resume work. But as you've just seen in that story, it still hasn't made much impact, especially for CHIPS compounds and health centers. This morning, we are having a conversation because your lives and that of others is at the heart of all of this. We've been joined by Ofosu Asamoah. He's Executive Secretary at the National Labour Commission. Grateful to have you here, sir. And now, a couple of days ago, we heard you asking for cool heads to prevail in this matter. I know there was supposed to be a meeting yesterday. Did it happen?
No, the meeting is scheduled for today and not yesterday.
All right, today rather. Right. So what are you expecting in that meeting, seeing that the physician assistants are really bent on, getting the act amended? What exactly is the meeting going to address today?
Oh, certainly, they have their position they are presenting. The authorities will also have their position, I'm sure. And we as mediators are going to make sure that they arrive at a settlement through negotiations. It's one of give and take, but if the parties take entrenched positions, then the matter may not be solved. And since they are, what do we call it, essential service providers, then we may have, in the worst scenario, resort to a compulsory arbitration.
Right. Mr. Asamoah, the physician assistants didn't just embark on the strike. I remember there were threats before they carried out the real deal. It's been about a week. From the point of threats to real execution. Did the National Labour Commission at any time try to intervene to prevent us from getting to this point?
Yes. When we got notice of their strike and their reasons for which they wanted to embark on an industrial action to ban their demand, we accordingly wrote to their employers that this is what we have at hand. What are they doing to prevent the happening of the industrial action? And of course, they will know that some steps have been taken, some meetings have gone on, except that they have been unable to settle. That is why it's gone this bad. And when it gets to this stage, then the commission will have to seize it, take over, and settle it. And that is what we are beginning from today.
And since you know, I mean, we're hoping to get a member of the Physician Assistants Association join us shortly. But if you don't mind, can you just run us through some of the demands they've been making specifically in terms of amending Act 857?
Well, apart from amending the Act, we have also called for their own regulatory body. I think they want to be separate from the Medical and Dental Council and have a council for the regulation of the physicians and physician assistants. Yesterday, we received a letter from the graduate division of their association requesting for a joinder. So we have accordingly granted and invited them as well. So we are not researching on all the issues because they keep adding up.
Okay.
And are joining. So today, if they appear before the commission, they make their presentation alongside what has been written here, then we can be certain of all the issues. But at least we know that they are calling for a council of their own. They are calling for certain amendments to the Act and the exclusion of some new introductions to the Act by the Medical and Dental Council. So this we have for sure.
And let me just find out from you, prior to this meeting, has the Commission reached out to the Medical and Dental Council? Have you also understood their point and concerns before this meeting that brings them together?
No, I only reached out was to send a copy of the issues raised by the senators to them. But we haven't called for any meeting. You know, we don't invite the parties individually. We always put them together. And here, that is what I think.
Right. So, if I get you right, this morning, all you're going to do is to hear the concerns of these two parties and chart the way forward.
That is true. That will be in the afternoon.
Okay. But this is not the first time the physician assistants are embarking on this strike, right?
No, this is not the first time.
So, in the initial...
There have been several strikes, but not for the same reason.
Yeah, yes, I need...
There have been several strikes for different reasons.
I appreciate that, but I'm just wondering why it seems to be the go-to decision for many aggrieved workers in this country. You're currently dealing with the CTAC strike as well. Why does it appear so? For many workers in this country, the main way to protest and to demand what they think they deserve is a strike.
That's the unfortunate aspect. Strikes should sparingly be used, and it is supposed to be the tool of last resort. Unfortunately, we have the reverse in Ghana now. People will not negotiate. People will not avail themselves to mediation, arbitrary, will always want to threaten strike. It's an unfortunate situation, but we are trying to handle it through education. I think our union members, management, employers, and government, all the parties will need some form of education to come to know that you don't really settle issues through strike. Therefore, that they can only get their demands through strike. Perhaps our employers have also only waited to respond to issues when there is strike. That is what is also happening on the other side. In most cases, our employers will not budge at their demands. They are not ready to negotiate until there is a strike. So perhaps that is what is happening. So we have to bring all the parties together and educate ourselves and come to accept that we have a duty to perform. We must deliver it on our mandate and not wait for a strike or a loss.
But Mr. Fusa, is it not also the case that a lot of these workers may have lost confidence in negotiation and even sometimes lost confidence in bodies like yourself that have been set up as mediators? Take CTAC, for example. CTAC says that, look, the National Labour Commission gave some directives they've not been complied with, and they think that you should escalate the situation instead of waiting for them to make another demand over the same concerns and finally embark on a strike. So isn't it the struggles also...
They did not have to make another demand. An award was given them against government.
Right.
And the next thing any adjudicator will expect is that when an order is made, the next thing is compliance. Now, if there is no compliance, then you will go for execution. When you go to court and a decision is given in your favor, and the judgment creditor does not, the judgment debtor does not pay, what you do is you apply to the court and go into execution. That is where the bailiffs and others will come in and go and sell the properties or this thing to satisfy your debt. In the same way, if the commission gives an order or a directive in your favor and the other party does not comply, you will come to the commission to report. Then the commission will go to court and seek enforcement. So if you sit back and say that because the commission gave a directive and the party against the directive has not performed, so you have lost interest in the commission, you have lost confidence, then you have lost confidence in yourself. Because the law is available, the law is on your side, and you are not applying it. If you don't apply to the court that the decision that you gave has not been complied with, for the bailiffs and other section of the court to go into execution, would you lose confidence in the court? Do you expect the judge, having given the decision for you and gone away, to be following you and going to make sure that it is done? You have to apply to the court. So if the CTAC at the time did not, and at the time that they complained and wrote to us on the 10th, we received this on the 10th, and on the 11th, I sent letters signed by myself to the government, through the Ministry of Education and Finance, to ensure compliance. And that is where we have got to. That today, the government, Ministry of Finance, have given the clearance to education to pay them. You see? So it's when we, but if you sit back and say we gave a directive and it has not been complied with, so you have lost confidence. I mean, you are throwing your hands in the air. When the law is, let's make use of the law. And the law, you must invoke it. It's like fetishism. If you don't play the drums and call the tune, the fetishism will not dance.
Right. Let me just end on this note with you, and we'll reach out to you much later in the day after that meeting between the physician assistants and the Medical and Dental Council. But I'm just looking at your role as the Labour Commission, which is to adjudicate labour disputes and promote conducive industrial environment for employment, sustainability and growth. We see you a lot when it comes to settling disputes and making interventions. What is the National Labour Commission doing in promoting conducive industrial environment for employment, sustainability and growth?
Yeah, we do a lot of education and training, except that in most cases, we are handicapped because of finances. So I was applying to Joy FM for an hour to do a program on labor education. You have to pay, and there's no budget for that. And then out to the industries, meeting the unions, having an on-site and off-site meeting and training, it all involves money. So that is our biggest problem. But for that, most of these issues will not come up at all. And we hardly get any sponsorship from both public and private sector, apart from the minimal money that is given us by the government. Unions and employers have failed to support the commission at all. All the unions, they have support in this direction. We have applied to them several times. We applied to companies. I've written letters to most companies, well-endowed companies, who have been sponsoring programs in this country that we all see. Beauty pageants, walks, and all the things you can think of. But
Mr. Asama, have you reached out to these companies and they denied help?
That's what I'm saying.
Right.
The full file of them. I mean, most of them, I mean, they just didn't mind.
And so this possible, this lack of financing you talk about, which makes it quite difficult for you to execute that part of your mandate, could be what is leading to the many strikes we are seeing. Because in answering that question, you made reference to a lack of education, right? So there's a correlation with your inability to execute this part of your mandate successfully and the decision by unions, groups, and other bodies to just go on strike without going through the other ways of settling disputes. Am I right to make that conclusion?
That is so. There's a case of a strike that happened in one of the very important essential providing industries in Ghana. It is a private power producer. When the leaders of the strike appeared before the commission, they said they didn't go on strike. He asked them, what did they do? They said they only stopped working, seized the gate, and they were drumming and dancing. So, you know what is a strike? The difference, the local chairman said no. He didn't know. We opened the thing, the act for him to read. And now he separates his action. The same happened in a company in Tema, a food processing company. They went on, they used what we call it, WhatsApp messages went down. And within an hour, they shut all the machines. And the place nearly caught fire. And the fire services, it could have taken them not less than 7 hours to quench the fire. And this company is located at an area where this tanks are, these petrol tanks. You can imagine what could have happened. They just didn't do what let's strike. They are not teaching us well. You see, without any notice, they keep shutting the machines. But if they were educated as to what strike is, when you can resort to strike, what you have to do, the processes, I think we won't get there. So we need a lot of education. If Joy FM, as I'm talking to you, we even granted 1 hour in every week, let's say 20 minutes every day to talk about labor issues. So we could do some education for Ghanaians to benefit for free.
I appreciate your time this morning. Mr. Fosa Samoa is Executive Secretary of the National Labour Commission, and we brought him on this morning because there is a meeting later today between physician assistants and the Medical and Dental Council. As you may be aware, the physician assistants are on strike. Among others, they are demanding an amendment to the Health Professions Regulatory Bodies Act, and they're also demanding a couple of other things. So we spoke to him about that, and then much later we delved into other labor issues. But let me take you to Kenyasi in the Ashanti region, where my colleague is standing by, Nana Boache Yadom. He visited the place, and he brought us that report on how patients are being turned away or referred to other facilities because there are no physician assistants on site. And, you know, the nurses cannot work without the presence of these physician assistants who usually head some of these facilities and CHIPS compounds. Well, if you can hear me, what is the situation like today? Same old story?
Well, Bernice, the industrial action by the physician assistants has really taken a toll on healthcare delivery in the Ashanti region across some rural areas that we have visited since they started the industrial action last week. With about 2 weeks entering into the strike action, we visited Kenyase Healthcare Center, the Antwa Healthcare Center, and the situation is still the same. They are still not back, and then it is really affecting healthcare delivery at these healthcare centers that we have visited. admitted. We are currently at the Kenyase Healthcare Center. Under normal circumstances, we could find some patients sitting here and inside the ward waiting for their PAs to attend to them. But as we speak, the PAs are nowhere to be found. They are not coming to work. So these patients who visit the Kenyase Healthcare Center are being referred to nearby hospitals, in fact, larger hospitals, to seek health care. As at yesterday, when we spoke to the nurse in charge, she gave us a figure of over 100 patients who have been referred so far since the industrial action began. They've been referred to nearby hospitals to seek health care, and we can count some of these patients trooping in this morning and being referred. The figure they gave us is 20 patients being recorded or being referred daily. So as we speak, we can count some patients coming in and some others being referred by the nurses. I have the chief physician here with me who would give us a figure and then tell us, chief pharmacist, sorry, who would give us a figure of how these patients, the number of patients who have been affected so far by the industrial action and the way forward. Boss, so far, how many patients have been to the hospital since they began the industrial action, and what is their situation when they visit the Kenyase Healthcare Center?
In fact, say omumbaha no mo de ana eba ni say yese ka che say omunko nearby hospital ada say menhia na say konfo anochi ya na ha omupa obi ho a wa ni say ye rural areas ni me fancy be a sub districts ni adi lorry fair crowd de beko hospital hon mo no ya refer no wonya bi nti e na ha adwen last year we say community ni mu me namwa ba ku hia me ohun me wo se ne ma me a e refer no nyame nko anka wo kwan so nti e wo say government hwe na utimi ekhu o masem na o mo ka no ana say Ghana Health Services utimi bem but since then yenti o mu bia ama affect adwuma eye na amanfo community ni so no o health.
Okay, what he is saying is that a patient that they referred last week nearly lost his life or her life as a result of the industrial action, but they have nothing to do because they cannot do the work of the physician assistants for as long as they are not coming to work. He's pleading with government to do something about this. Ebanisana nurses no edena yana omoye wahanum say.
Me pacho nurses ne de omo no adwuma ne say physician assistants eni ho a omu ni adwuma bia oye. And I share organogram nan so e Ghana Health Service na physician assistants in health centers near nyina omo na ye overall head nti ono anya adwuma ye ne aye wona ase ne nyina na adwuma ne nyina eye kwa nti e ba adwuma no an se tete ho saa obi aba ne aka che ne se onko e be aba ne aka che ne se onka e ha have delivery no nti government tries to betima bibia fa ho no wa hia wo mo se be ya o mo betimi hu se o mo demand so nkonye enye sika asem and our government what makasi be a minisika me betua omuka but we more fight ama community in the whole world because said doctors ne pese omuka omusa gu omubo na omumu ntimi mo omunya adwuma gi so omu ne supervise ne de emmoa Ghana Health Service delivery no nti omu hwe nkama patients nso nya ahoɔden a ombetimi de atase ne nipa no why health insurance oba beje ne nkwa na obi no ye anase obi self interest nti
Okay, so he is saying that the nurses and others under the organogram of the Ghana Health Service have nothing to do when they come to work because the physician assistants who are to supervise these healthcare centers are on strike. He's saying that government should listen to the plea of these physician assistants and aid them with whatever they need so that they can also come back to work. So far, nurses, patients saying, and I'm a refer omo, ewa hanum saying kwa.
Oh, since last Monday, they started any day. Patients, my fancy be a say, yeah, any daily you cry, baby, be a 30 crana. Now, all the time say, this night, and out to say, patient, pure baby, I just hear a friend. I'm an call nearby hospital.
Oh, my figure said 30 in a day.
In a day, yeah. In a day, bit my friend, if I bear 30. Omunyina so echo, obi ayen hwe obi a. And to say bia nipa no gise ANC or ko ANC dia, and ye ombeti ma hwe no. But say oba OPD general side there oba ebe refer am wako because doctor obehwe ono oni ho
na eba ne sana patients no so no fa situation say omutimi kọ nearby hospitals na mo refer omo so
mo na me ma example no ebi ntimi nkọ bo ho akọ anu de ne yare na akọtena fie sa nti se nyame amamu a na obo se wahwere ne nkwa so nti na me ka se ba akuhia me o ka se nyame nkọ a ne ma me nkọ owi as you say we da intensive care because enka tata oba e timi hwe no ha nka situation in Nusa said the Nkababia could drone.
Okay, so Benes, he's saying that they refer about 30 patients in a day since the physician assistants began the industrial action. That is from last week up to date. So they've been referring about 30 patients daily, which is quite a huge number. He's saying that if the PAs were to be around or were to come to work, they would not be referring these patients. At least they could be helping them with whatever they need. But for us, it stands now as they continue their industrial action. They have been referring about 30 patients daily.
You for now, and get onto the phones and speak to Michael Kofieje. He's Ashanti Regional President of the Physician Assistants Association of Ghana. I'm grateful for your time this morning, Mr. J. And clearly, we've assessed the impact of your action, especially in the Ashanti region, and we see that many people who would usually visit CHIPS compounds or health centers are being asked to go to other facilities. So clearly, the people are feeling the pinch more than the government or the bodies that your requests will be granted by. There's a meeting later today between the Medical and Dental Council and the Physician Assistants Association of Ghana. Just for the benefit of those who may not appreciate what your concerns are, if you can just start off on that note, what exactly do physician assistants want?
Hello.
Hello, Mr. AJ. Did you hear my question, please?
Can you repeat the question, please?
I'm just asking for the benefit of those who don't know or have not been following the conversation. What exactly do you want?
What exactly we want? Greetings to all the listeners and my colleagues this morning. What we want is for the Medical and Dental Council to do a holistic regulation and not to pick and choose. For now, we feel that they are picking on us. Now, if the Medical and Dental Council would regulate us and would want medical officers to supervise us directly, something that we're doing already, we are saying that it's going to hinder us in delivering care, because if I have to prescribe, if I have to manage a case, and then I'll have to place a call to a doctor somewhere, who will tell me, do this, do ABC, don't do that. What happens if the person is in theater or engaged in something else? There are places where the network is not that good. And does it mean they would have to come to the health center to sit by us in the consulting rooms? It doesn't allude to the benefits of our clientele. They are not doing things properly to help the rural folks that we see.
So, I mean, you have embarked on this action. Did you try other means of getting the Medical and Dental Council to listen to your concerns and demands? I'm asking this because I just spoke to the Secretary of the National Labour Commission, and he was talking about how strikes have become the norm when they're actually supposed to be the last resort. What are the processes you went through with the Medical and Dental Council before making a decision to embark on the strike?
The Medical and Dental Council, on different occasions, we've been in talks with them.
When you say you've been in talks with them, how have these talks been done? Is it through formal correspondence, or you sat in meetings?
Formal correspondence, and then we've had opportunity to engage even the current registrar at one of our annual general conferences, and it didn't end well. I would say that all these engagements have not yielded any good results. They do what they want to do because they feel that the physician assistant is being given too much to do. So we have to be extreme. Quote unquote, our income.
Right. So there's the other thing, and I'd like you to address this for me. You say that you want to be independent. What does that really mean? Is it that you want an association for yourselves, or you want to be treated like doctors, or you want to be given the power where there is no doctor available to make decisions that a medical doctor will make? What exactly do you mean when you say you want to be independent?
We have to be doctors. We are not doctors. We are not medical officers. We are physician assistants, and we are very happy to be physician assistants.
Sorry, Mr. J, I'm struggling to hear you. If you can.
Yes, that's because I'm in a moving vehicle.
Okay, sorry about that. But if you could just try a bit for me.
I'm saying that we are physician assistants, and we are happy to be physician assistants. We are not seeking to be doctors. We are not seeking to get any power. That we are not. But if you think to reduce our scope of practicing medicine, you see, when you say that the care of staff that has the power to practice medicine and dentistry,
sorry, Mr. J, I'm really struggling to hear you. I hope we can reconnect, and because I'm really interested in that aspect of the conversation. What exactly you mean when you say you want to be independent? But the lines aren't helping me today. We would hopefully try to reach him. Michael Kofi J is Ashanti Regional President of the Physician Assistants Association of Ghana. And this morning, we just wanted to understand basically what their concerns are and why they have gone on strike. And it's not only in the Ashanti region, this is nationwide, but we just chose the Ashanti region as a focus point to study what the impact of this decision by the physician assistants is. And clearly, as you can see or you have heard, the hospitals are empty. The nurses cannot work without these physician assistants, especially in rural communities where the physician assistants head the health centers or the CHIPS compound. Hopefully we can reach Mr. Kofi J and get a better connection so we can hear him. Too bad it was impossible to reach him on a stable line, and hopefully we'll be able to do so, especially because there's a meeting later today between the National Labour Commission, the Medical and Dental Council, and the Physician Assistants Association of Ghana. So do stay with us here on your most credible news source for more on that. Up next is AM Business, brought to you by EcoBank, the Pan-African Bank.